Frozen shoulder. Frozen shoulder, also called adhesive capsulitis, is an inflammatory process characterized by joint pain, stiffness, and limited mobility in the shoulder. Frozen shoulder most commonly affects people between the ages of 40 and 60 and occurs in women more often than men. In addition, people with diabetes are at an increased risk for developing frozen shoulder. In frozen shoulder, the shoulder capsule becomes so thick and tight that it's hard to move. Thick bands of scar tissue form, and there's less of a liquid called synovial fluid that keeps the joint lubricated. Signs and symptoms. Frozen shoulder is a common condition that presents with pain and progressive limitation of both active and passive shoulder movements. The main symptoms are pain and stiffness in the shoulder joint that make it difficult or impossible to move. In most cases, the symptoms begin gradually, get worse over time, and then resolve on their own or with treatment in 1 to 3 years. It's also possible to get frozen shoulder more than once. However, frozen shoulder rarely recurs in the same joint. Most people develop the condition in the other shoulder. Frozen shoulder develops slowly and in 3 stages. Each stage can last several months. Each stage has its own unique symptoms and timeline. Stage 1, freezing. During this early stage, even the slightest movement of the shoulder causes pain and the shoulder's ability to move becomes limited. Freezing typically lasts from 6 weeks to 9 months. Stage 2, frozen. Painful symptoms may actually improve during this stage, but the shoulder becomes stiffer. Moving the shoulder becomes more challenging and it becomes harder to get through daily activities. This stage can last 4 to 12 months. Stage 3, thawing. During this stage, the shoulder's ability to move begins to improve. Complete return to normal or close to normal strength and motion typically takes from 6 months to 2 years. Causes. It's not clear why some people develop it. Certain factors may increase the risk of developing frozen shoulder. Adults aged 40 and 60, particularly women, are more likely to have frozen shoulder. Certain medical conditions associated with frozen shoulder include hypothyroidism, hyperthyroidism, Parkinson's disease, and cardiac disease. Frozen shoulder can develop after a shoulder has been immobilized for a period of time due to surgery or an arm fracture, or if you are recovering from a medical condition like a stroke, or it's common in women who have undergone mastectomy that prevents them from moving their arm. Having patients move their shoulders soon after injury or surgery is one measure prescribed to prevent frozen shoulder. Diagnosis. Frozen shoulder can usually be diagnosed from signs and symptoms alone. After discussing your symptoms and medical history, doctor will examine your shoulder. He might ask you to move your shoulder in all directions to check if pain occurs with the movement and see how far you can move your arm. People with frozen shoulder have limited range of motion both actively and passively. Then you might be asked to relax your muscles while the doctor moves your arm. A physical exam is usually enough to diagnose frozen shoulder, but your doctor may also order imaging tests such as X-rays, ultrasound or MRI to rule out other problems. Treatment. Frozen shoulder generally gets better over time, although it may take up to 3 years. Most people with frozen shoulder improve with relatively simple treatments to control pain and restore motion. For severe or persistent symptoms, other treatments include applying heat and ice to the affected area. Many people suffering from frozen shoulders opt to go through physiotherapy. The most obvious symptom of frozen shoulder is stiffness and loss of flexibility. Hence, your treatment might also include going to a physical therapist for strengthening and stretching exercises to improve your range of motion. Physical therapy is used to help restore movement and reduce pain. Over the counter non steroidal anti inflammatory drugs may help reduce pain and inflammation. Sometimes, injecting corticosteroids into the shoulder joint might help decrease pain and improve shoulder mobility. Hydrodilatation is a non surgical radiological intervention used in the management of frozen shoulder. Injecting a large amount of saline containing steroid, local anesthetic, and contrast material into the glenohumeral joint under imaging guidance Typically, around 30 ml can help stretch the tissue and make it easier to move the joint. If your symptoms are not relieved by therapy and other conservative methods, you and your doctor may discuss surgery. Surgery for frozen shoulder is rare. The most common methods include shoulder manipulation and shoulder arthroscopy. Shoulder manipulation or manipulation under anesthesia can help loosen up your shoulder tissue but is very rarely done anymore because arthroscopic surgery has replaced it. The intention of manipulation of the frozen shoulder under anesthesia is to forcibly rupture the contracted capsule. During this procedure, you are put to sleep and your surgeon would forcefully move the shoulder under general anesthesia. This releases the tightening and increases range of motion. Complications: fracture of the humerus, rupture of the biceps tendon after shoulder manipulation. Shoulder arthroscopy. Arthroscopic surgery is done using pencil sized instruments inserted through small incisions around your shoulder, and your doctor will cut through tight portions of the joint capsule. This can help loosen the joint capsule, allowing it to move more freely. Outcome: frozen shoulder does recover in most people, but the recovery may take 1 to 3 years. One of the most common causes of frozen shoulder is not moving a shoulder while recovering from a shoulder injury, broken arm, or stroke. Many cases of frozen shoulder are mild and will resolve with analgesics and physiotherapy. In some cases, however, even after several years, the movement does not return completely and some degree of stiffness remains. About 10% of diabetic patients will have residual shoulder stiffness and disability after surgery. Although uncommon, frozen shoulder can recur, especially if a contributing factor like diabetes is still present. If you have had an injury that makes it difficult to move your shoulder, talk to your healthcare provider about exercises that can help you maintain your ability to move your shoulder joint. Thank you.